Hi, this is Dr. Bob Dannenhoffer. I'm the Public Health Officer for Douglas County, and this is it's March the 24th, and things change so quickly that I think we need to know what the dates are, because things I may say today may not pertain tomorrow. So it's been a busy day. The world has seen a tremendous increase in the rise of COVID cases. So Italy, Iran, Spain, France, and the United States have all seen great numbers of increases. For example, the U.S. had almost 9,000 new cases today. So this day is the day with the most new cases we've ever had. So this is really a problem. We're really starting to see a lot of new cases all over the world. So I think we do need to be very careful about that. So we're going to take some questions and answers today. A lot happened today, and let me fill you in on that. So we did another screening clinic today. We did over 40 people in the screening clinic. Those are going great. We've gotten it down to about 2.5 minutes. And so there was absolutely, by the middle of the thing, we were actually a little ahead, so there was no way to do it. We got plenty of new swabs. The problem with it is the testing is still a bit behind. So our tests from last Tuesday are still not all done yet. The tests from Friday, interestingly, some are done and some aren't done. So of the 52 that we did last week are completed. There's no positive in those, but there's still 40 or so that we're waiting on. In addition, the state does tests. There are no new tests there. And then other people are doing tests in offices and whatever, and 2 of those are positive. So there are 2 new cases in Douglas County. We're tracking them down. We've contacted the people and see what their contacts are. We don't think that there's any great risk in the community, but we'll be tracking down those contacts later tonight and through the night and tomorrow morning. So we saw today in the clinic, there was certainly some sick people, but not nobody who was really tragically ill, nobody short of breath. So the question is, when's the next clinic for testing? We're going to have to know about what openings the lab has. We have plenty of equipment and plenty of people, and tentatively we're going to do it Friday at 12:30. Becky Bright is collecting the things from your doctors, so if you need to get these tests, do it. Now, there are a bunch of people today who got testing who probably didn't need it. They were getting it because they thought they needed it to go back to work. You never need one to go back, a negative test to go back to work. So there may be room on Friday for new people to go ahead and get these done. Again, the testing is moderately uncomfortable. We take this Q-tip and stick it about 5 inches into the nose, let it sit there for a while, twirl it, and then take it out. There were a number of people today who felt this distinctly uncomfortable, and indeed it is. So we think we may be up for Friday for more testing. Now again, these 2 positives came out were not from our clinic, not from our screening clinic. They came from other clinics and other outpatient places that people would have. So one of the questions is, can you speak to what's happening with PPE? So PPE is personal protective equipment. That's goggles, masks, gowns, and gloves. And we in the community here are working really, really hard to be sure there's always enough. I don't want to get to a spot where we have run out of this stuff and now people have to expose themselves to potential illness in the hospital. And so we've been working very carefully with Mercy Foundation, with Mercy Hospital, Kristen here, to go ahead and do that. So there are people who are trying to make masks. My wife is doing that. And so making these absolutely adorable masks. Again, these masks are probably not great for healthcare workers, but they're very good for people who are sick. And on the screening clinic today, I saw a lot of people wearing masks. Some didn't have very good masks. There was one guy who had a T-shirt around his neck. I think a homemade mask would be certainly better than a T-shirt. So we're trying to do that. If people are interested in doing that over at Seri Graphics or on Jackson Street, they're putting those together. I'm told that they sent out lots of them and they don't have very many completed yet because they do take some time. My wife is a very good sewist, and it takes about 15 or 20 minutes to make a mask. They look great, and hopefully by the end of the week, we're going to start distributing, especially to clinics, to the hospital, and sometimes to EMS. So the question is, confirm that we have 3 positive cases today. Well, we had 1 positive case about 3 weeks ago, and then we have 2 new positive cases today. So yes, we have 3 positive cases today. So the question is, what about first grandbaby is due soon, and mom is still working in the public at a drive-through window, and Susan asked this question. I say, Susan, grandparenthood, the best job there ever was. So that's great. This is a tough time. Now, we don't think themselves are at much high risk. There was one report that came out earlier in the week, but it really was not a high risk like it is with flu, and the risk for the babies do seem to be low. Actually, really the biggest risk is that they will have something and give it to you. So the recommendation really is that if you're a grandparent age, that you do isolate yourself. But as a grandparent, that would be one of the hardest things to do. So the story is, how do we report people who are not following quarantine? So we don't really have the quarantine police out there. China did, and other places have, where they've been really into that. I think the story is that we have people who are not doing quarantine. If you give us a call, we'll send a friendly note that, look, you got to do this, because this is really the only hope we have to keep the cases down. Remember, there's no vaccine, there's no specific treatment. There's no anything else we can do to prevent this other than to prevent people from getting it. So social distancing, the most important thing. So the question is there any concern with mail or packages? Well, this virus does live on surfaces for a short time, but we don't think that actually picking it up and doing it is a big risk. If you're worried about it, you could use gloves, even just the rubber gloves that you use to clean the toilet, if they're clean, to go ahead and open the package. The stuff inside the wrapper should be fine. If you want to take that off and get rid of it, that would be being incredibly scrupulous, but I wouldn't worry about it. So the question is, do people who have a positive test? And Debbie asked this question. So the story is, do they still have a positive test? So a study came out this week, and what they did is they looked at people and they swabbed them every day until it was gone. And for most people, 14 days after onset, it was gone. Now, there were some who persisted a little longer. There's this funny story about the Diamond Princess that they could find some viral particles months later. So this virus may be a little more persistent than most respiratory viruses, but that doesn't seem to be the case. Now, it turns out that people cough well after the virus is there. So if people wait to go back to school and back to activities until the cough is gone, the virus should also be gone. So the question, where do the people who tested positive live? The people who tested positive live in Douglas County. None of them had traveled outside to one of the high areas. None had known contact to another area. These were people who lived there, were tracking down their stuff. They lived in Douglas County. They don't live all in the same place. So they live throughout Douglas County. And again, following the Oregon Health Authority, we're not releasing the hometowns of people. We'll release age ranges and we'll release things like that, but we're not going to be releasing the specifics of where people live. So we do have the hotline still up. They're going 8 a.m. to 7:30 p.m. The number 541-464-6550. And again, they're open 8 a.m. to 7:30 p.m. They're doing a beautiful job. They've taken well over 500 calls. Remember, when we set this up, that we had two goals with this. One was to take some pressure off the ED, but the other goal was to give people accurate information. We think they've done that. So how will we update when more tests come in? Well, these tests come in every hour. So they're coming in through the day and night. We have people monitoring this all through the day, and when new tests come in, we'll do it. So the state, it's a little confusing here, but the state gets the tests at the same time we do. And so what happens is the state has an 8 a.m. cutoff. So if it's been reported to the state by 8 a.m. in the day, they'll report that number. So if you looked at the OHA website today, it says Oregon has one case as of 8 a.m. These cases came in between 8 a.m. and it's now 5 p.m. And so we've been working on through that. It's possible that more will come in through the night and that those will be released tomorrow. But again, they're coming in all through the day as they get released by the laboratory. We're following up on it as soon as we get them. And in this case, I think within 2 hours of the time we knew it, the News Review knew it. So we're really certainly not hiding something. So the question is, what should someone who tests positive do inside their home to protect others in the family? So you can go to the Register Guard. They had a lovely infographic about what you should do. It was nicely done and nicely written. I'll try and repeat, but I won't be nearly as eloquent as they. So if you test positive, ideally you should be in your own room. Ideally, you should only be in a bathroom that you use. Ideally, you shouldn't see anybody. And ideally, people should leave food at the door, knock on the door, wait 5 minutes, you go out and get it, eat it. When you're done with it, put the tray down, and then you close the door, and then they come pick it up. So really not to see anybody during the time that you're there. Typically, if you're going to spread this by respiratory droplets, you're going to spread it to someone who you can see, right? It's not going to go through the door, through the wall, but it's going to be somebody you see. So we would recommend that that's the way. Now, I know that's not always possible. Everybody doesn't always have an extra bathroom. Everybody doesn't always have enough rooms to do it. But ideally, that would be the way to do it. Now, a lot of times in families, you slept with the person or were close with the person before you had symptoms, so they may also be exposed. But what they did find in Korea and in China was that there were a number of discordant couples. So there were couples where one person had it and the either other one didn't get it or they were asymptomatic. So it's not like if one person gets it, it's certain that the other one will be infected. So again, they're writing these furiously here as we do it. Say the hotline again. And the hotline again is 541-464-6550. In addition, if we have any sewists out there who would like to sew some masks, talk to the people at Serigraphics, because the people at Serigraphics will go ahead and do that. As soon as we get them made, we're going to distribute them to other people around. Again, the hotline 541-464-6550. Okay. One more question. So the question is, how are they billing for the tests? So these tests that we're doing through Quest Laboratory cost $199. And so they cost $199, but the good news is that Quest is holding the billing on these because there's been a suggestion by the president and by the governor that individuals will not have to pay a penny for these tests. So rather than collecting money or doing things like that, we have not collected any money. DPHN and the group that's doing this are collecting these tests. We're not charging at all for the collections. So I think people are getting these tests and haven't seen any billing. Now, at some point, we are going to figure out who's going to pay for the test. We think the feds or the state will pay for the test, or your insurance company. So I wouldn't worry about the cost. The most important thing is we would like to test people who have some logical risk of having it. So getting a test just because you want it, probably not good. But if you had cough and fever, especially cough and fever for more than 2 days, those would be the kind of people to do. So we are trying to move into the modern age. I know I'm an old man, but we have YouTube channel, we do Facebook, Instagram, Twitter. Every day we do a press release with the county. So if you want to get that, those usually come out around noon. We have a bunch of videos posted to YouTube and our website. We're trying as best we can. So if people have suggestions about how we could get out there better or how we could better get the message out, please let us know. These Facebook Live things actually are better than I thought they would ever be. So I think they're great to answer questions. If people have questions in the interim, please go ahead and do that. There were 2 questions we'd had today. One was about wearing face masks in public. The answer to that question is that for people who are not infected, so the average guy out there trying to wear a mask to keep themselves safe, is kind of a mixed bag. Because one of the ways we think this spreads is people touch something and then they touch their face or their eyes. And so when you look at it, people touch their face a lot. And in medicine, what you learn is don't do that. And so I have to really struggle not to touch my face. I hope I haven't done it too much during these videos here. But for people who wear a mask is such an unusual feeling. And so the first couple of years you wear masks, you do tend to touch it a lot to readjust it or do things or let air in or scratch around it. And we think what that does actually is increases the number of times you touch your face, which actually increases your risk for infection. So when we've looked at, the general public wearing masks to prevent disease, it's kind of a mixed bag. Some suggest it increases infection, most suggest it has no effect, some suggest it decreases infection. So if you want to wear a mask in public, I'm certainly not going to stop in your way. Our Surgeon General asks that you don't buy a mask in public because some of those masks you buy could be used for medical personnel who need them or sick people who need them. At the drive-thru today, many people had masks, and those people should definitely be wearing masks. People in general public want to wear masks. I don't have a strong feeling one way or another. As I said in one of the previous ones, I lived in Japan for a while, and wearing masks was sort of a thing in Japan. And so if you look at the ninja things or the anime, right? So the Japanese anime, a lot of the Japanese anime people wear masks, and I don't think it's because they're protecting against coronavirus. I think it's just a thing. So if you want to do it, that's okay. It's neither recommended nor discouraged. We just don't want people to buy masks and take them away from the hospital or EMS providers who need them. What's that? Is that the last question? Okay, that sounds like the last question. We're going to do this again, probably depending upon what's going on. Certainly no later than Friday, but we may even do one before then if something new or different comes up. And the way things are going in the world, something new or different may come up at any time. So, I'm a real nerd looking at these numbers. It took a long time for us to get to 1,000 cases. Not very long in this country to get to 20,000 cases. In just a few days, go from 20 to 40. So, things are moving really quickly, and so we don't know what's going to happen. I think, actually another question that we had is there was this ranking of Douglas County, the fourth worst place to live. And that was an analysis that somebody did. I think they're probably during this lockdown, a lot of people with too much time on their hands. But what they did is they looked at vulnerability, and they looked at the age of people. Douglas County has got old people. They looked at poverty levels. We do have some poor people. And then they looked at the number of hospital beds. Douglas County has a relatively low number of hospital beds because much of the specialty stuff that's done in Douglas County is done either to the north or south, and those beds aren't in the county. So, for example, I'm a pediatrician, and there's a very specialized neonatal unit up in Eugene, and appropriately, we don't have enough babies born to have one in Roseburg, so almost all of the sick babies go to Eugene. Same for neurosurgery, same for other kind of things, and so those don't get counted in our bed total. Because we're such a big county, we're the size of the state of Connecticut, so we're such a big county, it didn't include those numbers. And so it looks like we had a relatively low number of beds. So it said you've got an old population, you've got a poor population, and you don't have a lot of hospital beds. That's why you're at risk. Well, let me counter that. The number of old people are the number of old people. And poverty is not really a big indicator in this disease, because if you look, some of the people who've gotten the worst outcomes with the disease are people in very rich areas like New York. And our lower number of hospital beds, I believe, is a little bit misstated because it doesn't include all of those beds in Eugene and the beds in Medford that we use. And as I said to people, really, you think you'd rather be living in New York City at this point than here, where New York City is locked down, has all those things, versus Douglas County, where there's no one in the hospital with this disease, and we just have three cases. So again, this is time to pay attention, but certainly no time to panic. With 3 cases, we know the virus is here. So I would absolutely tell people this is time to follow social distancing. Social distancing means keep everybody 6 feet apart. Social distance means stay away from stuff you don't need to be at. At the most part, stay at home. Because right now, with just a few cases in the county, if we really do a good job with the social distancing, those 3 cases will sort of go away, and we'll never have more than a handful of cases. On the other hand, if people don't listen to the social distancing and spread this, we could wind up with hundreds or more cases, in which case it would be really hard for the county. So please stay home, stay healthy. Again, this is Dr. Bob Dannenhoffer, Public Health Officer for Douglas County, another Facebook Live. If you do have questions or comments at the Facebook Live channel would be great. And we'll see you again no later than Friday, but who knows, maybe tomorrow or Thursday too. Bye-bye.